Hi, I'm Carissa. I'm going to be your CNA today, and we're going to give you a bed bath, okay? So we're going to start with our hand hygiene. We're going to pull the curtain to provide privacy. I'm going to grab some gloves really quick. And for this skill, we'll need a basin that will fill with comfortably warm water, a bath blanket, 5 washcloths, and a towel. So let me go get my water and my soap. Okay. Bring this over to the patient. I'm going to put this over here. I got you warm water, okay? And then let me grab my supplies. And then I'll make room over here. And with this one, we only need to wash her face and one arm, but we're going to prepare the resident as if we were giving a whole bath. So what we'll do is we'll put the bath blanket over our blanket, and then we'll ask you to hold this right here, and we'll pull this down. So in a sense, we're preparing them for a whole bath as if they were completely naked under here. Once we take off the gown, let me raise the bed. And making sure it's locked for safety. Good. For right now, we're going to remove the gown. So you can either unbutton or take out their arms. It's up to you, whatever's easier. And then keep them covered, maintaining dignity for our patients and residents. And then hold on to that one more time. And then we'll pull the gown out and dispose of it into the laundry basket. So now we can take our washcloths, and we're going to keep her covered so she can stay warm. We're going to start with the face, but we're not doing any soap on the face. I like the 4-corner method with every skill I do, because then you have 4 corners every time. So what you want to do first is you want to start with the first corner, and you want to wipe the eye from inner corner to outer corner, and then you want to get a clean corner, and then the other eye, inner corner and outer corner. And then with the last 2, I like to do the rest of the face like this, and then the other side. And then that will be that one, and then you'll dry. You can dry the same way, or you can pat dry. It's up to you. But make sure each time you lift up the washcloth, you get a new corner. And then you'll take your towel, and you will only expose one arm, because we're only needing to wash one arm. So make sure you only expose one. You put a towel under their arm so that we don't get the bed wet. And then now we can use soap. So we'll take our washcloth and our warm water, do the 4 corners again. Make sure it's not drenched. And then soap on each corner. Three and 4. And then what I like to do is always start with the hand. So in like the first corner, do like the whole hand, new corner. Then we'll do the underside of the arm, new corner, the top side of the arm, and then last corner, one swipe on the armpit. Make sure you move your stuff, sorry. And then laundry basket, and then we'll rinse the same way. So 4 corners, and then hands, and then new corner, underside or top side, however you want to do it, as long as you get both sides. And then final corner, one swipe on the armpit. And then I also dry the same way. And now that she's dry, we could take out the towel. And then take care of that in a second. Get a clean gown that we can apply our patient. And then the way to apply the gown would be kind of the same way we took it off, so we'll put it over so we can keep privacy. And then we'll put this arm. Again, maintaining dignity and privacy. We'll do this arm. And then you can go ahead and pull out this towel. Bath blanket. And then we can cover the resident back up. And then we'll lower the bed from down here. And then now that our bed is lowered, we'll dispose of our stuff and then come back and get our patient situated. So make sure you just empty, rinse, and dry. And then return to storage. Trash. Here's your call light and your water. Okay. And then you can maintain your patient in a position of comfort if you want to lift up their head, as long as they're comfortable. And then finish with hand hygiene. And you're done.